In the intense world of medical emergencies,
one patient, 3 times stab wounds.
There's nothing more extreme than a code red.
This is a 2-car RTC.
That's correct.
It means there's an immediate threat to life.
Got 1 male still trapped in the vehicle.
In the West Midlands, a highly specialist team is ready to race to these major traumas.
ETA 4 minutes.
By road and air.
03, we are lifted from Cosford.
Responding to the most severe 999 calls.
Open up the Lucas device over there for me.
Day and night.
All right, well done.
From car crashes
Just need to check.
to stabbings.
We're going to put some oxygen on your pal.
Here, where time is critical, lives will be saved. On roadsides and inside homes.
It's okay, coming off the chest.
These emergency doctors and paramedics use cutting-edge trauma techniques in surgery, normally only seen in operating theatres, to save people from almost certain death.
Sorry, mate.
I know, mate. I know. We're going to sort you out.
Filmed alongside the critical care team,
Ready, set, slide.
we captured every vital second as these specialist crews work to save lives.
On roll. Ready, steady, roll.
Tonight,
Were you thrown at all?
Yes.
Yeah?
a man is in agony after a motorbike crash,
Mate, this is the worst thing I've ever done.
a cardiac arrest in a supermarket,
If she has another arrest, you're going to do 3 stack shocks if needs be, okay?
a race against time to save a man's foot,
What we could do is to pull it to a better alignment.
90 degrees isn't good.
and a car crashed into a lamppost, trapping a child inside.
I know it's going to be a bit painful. Just bear with it, be strong, okay?
The critical care team in the West Midlands was set up in 2012.
Police are now on scene saying it is a significant wound.
Thank you, speak soon.
70% of the doctors on the team are consultant anaesthetists, who also work in hospitals all over the region.
We're basically a specialist team, effectively. West Midlands Ambulance Service will respond to between 3,000 and 4,000 calls a day, and the trauma service is commissioned really only 10 patients a day.
There are 34 full-time critical care paramedics who have each undergone a rigorous selection process before a further 18 months training.
So this is our mechanical CPR device, which can take over chest compressions, which is especially handy if we're transporting a patient on an ambulance.
Right. Ready for another thrilling instalment? See what the world has got in store for us today?
40-year-old critical care paramedic Stephen Mitchell, known as Mitch, has been with the team from the beginning.
When you've just enhanced the team or become a team on a job, you know, it does make you proud to be part of the system, and it's a good feeling, I suppose.
Ambulance service, is the patient breathing? Well, I think she's fine. She's suffering to blue.
Is she awake?
Hello? No, she's not conscious. Is her breathing noisy? Yes. I need you to look at her chest for me to see if it's rising and falling regularly. She's breathing, but she's grunting breathing and the face is blue. We are coming as quickly as we can, okay? Ambulance and siren.
An ambulance has been called to a local supermarket where the woman works, and Mitch has also been scrambled.
Chris has just given us an update about a job that's in Albury, somebody who's collapsed in a supermarket. I believe it's cardiac arrest. Crew's 5 minutes away, or we're 5 minutes away. They should be there by now. But really, these patients need quick management.
Without a heartbeat, the human body can store between 3 to 5 minutes worth of oxygen. But after that, the brain and major organs begin to shut down.
Night, night. Do you know an approximate age?
There's no details at all.
With no information to go on, Mitch and the ambulance crew must act fast if the patient's life is going to be saved.
Londis here. You're right.
5 minutes after he received the call, Mitch arrives at the scene.
Okay. You all right, guys? How you doing? Keep her on the side.
Yeah. She's had 3 shots.
Oh, yeah.
No drugs given. GCSE on Thursday now.
You've got just a normal O2 mask. That's it. We'll just get a free flow.
45-year-old employee Jo was at work stacking shelves when she collapsed. Luckily for her, the ambulance crew arrived within 2 minutes and managed to restart her heart.
Well done, guys. Okay. She's got a candle in.
Yes, she's got
So, keep her on the side there.
family behind.
Yeah, gotcha.
And then work colleagues.
The paramedics have hooked Jo up to an electrocardiogram, which shows a very agitated heart rhythm.
That 12 lead, did you see anything on it?
Came back at steady.
Mitch knows there's a real chance she may rearrest again at any moment.
You okay?
Daughter-in-law, are you a daughter-in-law?
Yeah.
Come here. Okay. What's the name?
Jade.
Jade. She's obviously had a cardiac event where they've had to defibrillate her, okay? So she's quite poorly, but we're looking after her. It's good that she's away.
Yeah.
Jo's brain was deprived of oxygen for several minutes, which has left her confused. Mitch needs to calm her down to minimise the stress on her heart.
I need you to sort of be around and talk to her. So if you go behind my colleague there, you just talk to her. Just.
Joe, we've got Jade here for you.
Jade's here.
The team now need to get Jo to hospital as quickly as possible. It's her best chance of survival if she does have another cardiac arrest.
It's the ambulance, okay? Just. Sorry.
Nottingham connecting a multiple request for ambulance and fire brigade.
Yes. Operator, hello, caller. Is the patient breathing?
I'm not sure it's a car crash, but they're stuck in the car.
How many vehicles involved?
Just one.
And what have they actually gone into?
Come off the road and gone into the curb and hit a lamppost. One person stuck inside. He's in a lot of pain.
Is that him screaming?
Yeah.
A major road traffic collision requires all the emergency services working together to save lives.
On it.
The critical care team on duty tonight are Dr. Ben Taylor and critical care paramedic Aidan Brown.
Patient still front to the left knee down. He's an 11-year-old male in the back of a
The passenger trapped in the back of the smashed vehicle is a young boy. A child's life is in danger, and Dr. Ben knows there's a lot that can go wrong.
Well, obviously it's a very cold night tonight, it's 4 degrees Celsius.
Physiologically, children are different from adults. They get colder quicker. They tend to compensate very well physiologically in terms of blood pressure and so on until they don't. So they've got the potential to become sicker very suddenly.
The police have arrived on scene, along with the fire brigade and ambulance crew. It's a big impact smash, and the boy's condition is deteriorating fast.
That's all received, many thanks. We're just approaching scene now.
The critical care team in the West Midlands was set up to improve the chances of survival to hospital for seriously ill and injured patients.
Monitor on there, oxygen down there.
Yeah, perfect.
Together with the Midlands Air Ambulance, the highly qualified doctors and paramedics fly around 6 missions a day.
03, we are lifted from Cosford.
Covering an almost 6,000 square mile region.
ETA 10 minutes.
On the ground, they rely on a fleet of high-powered vehicles to get to each emergency in the fastest time possible.
Turn right here.
Will Meadows has recently completed his 18 months advanced training to become a critical care paramedic. As this is one of his first shifts, he's being accompanied by Colin Apps.
I've been working for West Mids for about 19 years, but Midlands Air Ambulance for about think nearly 11 years now. Today I'm just doing a support shift for Will, so...
You're my mentor, my role model and mentor.
I'm not getting involved. I'm happy to sort of stay quiet in the background.
Be calm, mate.
Ambulance service, is the patient breathing?
Fuck, yes, this is a serious cut to his right wrist.
Okay, is he conscious?
Yes.
I'll be able to speak to him?
No, he's in.
Can you ask him how he's done this?
Have you looked, mate? Cancel. No, mate.
They're coming as quickly as possible. Is it gone grey in the face? Is he a deathly colour?
Oh, Jesus. Yes. Relax, yo.
Keep supplying that pressure until we get there. They're coming on a blue light.
An ambulance has been called, but the man's condition is so serious, critical care backup is needed, so Will and Colin are also en route.
So it's a 26-year-old male who's sliced his arm with a tool of some sort, bleeding quite heavily, and apparently he's now unconscious.
If the man's unconscious because he's losing too much blood, he could be about to go into cardiac arrest.
He's had to be put on the floor, legs raised. There's a crew only a couple of minutes away, so we should get an early update.
They're gone. There's 6-2 get hit.
6-2, I've just spoken to the crew. They say the patient was in the street. They've got him onto the back of the ambulance. He's GCS 15, but looks very grey.
13 minutes after they were called, Will and Colin arrive on scene to be briefed by the ambulance crew.
All right, thanks. My name's Will.
Has been working on a building site, ground floor, just across the road from here. He's been using a plunge saw. Thought he had it all stable and reached underneath it, but it's still been going. It's dropped and gone through his arm.
Okay.
We've just got quite a deep laceration to the right forearm there.
Righto.
The blade has sliced open a deep 3-inch wide wound.
Have a clean bandage as well, eh? Clean cut. Went quite grey. Was quite shocked from everything that happened originally. Had his legs raised on our arrival.
Rich was working alone when the mechanical saw caught in his coat and sliced through his arm. He ran outside to get help before collapsing unconscious in the street.
Got my first set of rods done now. Just got him inside because it was so cold, really.
Lovely,
so,
lovely.
Quite deep.
I think we have gone through some tendons or ligaments there, haven't we? But not much in the way of blood loss.
We're unsure. The towel that was wrapped round him disappeared once we were getting there. There was some blood in his left glove, so we're not sure exactly. There's no blood loss through the floor either.
Oh, well done.
If the blade has cut through muscles and tendons, there's a chance Rich could lose the use of his arm.
Do you think there is tendon damage?
It looks like it.
Joe, we're just going to slide you back, my darling, all right?
In Oldbury, Mitch is working with the ambulance crew to get 45-year-old supermarket worker Joe to hospital.
If you're happy, mate, what we'll do is we'll just pick her up and then someone feed the stretcher straight in so we're not all like... Right. Well done, guys.
She has suffered a cardiac arrest and is fighting for her life.
You okay, Joe?
Her daughter-in-law, Jade, is also on scene.
Can you just carry on talking to her, Jade? That's it.
She went to the doctor yesterday because she had pain in her arm.
Pain in her arm.
But she couldn't get an appointment. Yeah. You okay, Joe?
So everybody on the side, pull apart slightly as well. So, and then just watch everybody's toes. Okay.
1, 2, 3.
Okay. Advance. Mind your toes. Okay, lovely. Okay, so guys, can we go a little bit further over that way, and then put her on her side? Okay, because if she vomits,
It's 26 minutes since Joe had a cardiac arrest, but Mitch knows the window for her rearresting is still wide open.
Have we got a little cushion for her for underneath? You know, can I just insist that we keep her on the defib? Sorry, we need to know what's happening, don't we?
The cardiac monitor contains a defibrillator, which can be used to deliver an electrical shock if her heart rearrests.
You ready for a quick update?
9-8, yeah, go ahead. I've got Rocket 1132, that's correct.
Yeah, female, appears to be in her 50s. I can confirm some details, but looking to go to PCI centre. would you mind just seeing which is the closest? We're thinking city.
6 minutes after he arrived on scene, Mitch has his patient packaged and ready to leave. He radios control to report on her condition.
Yeah, currently GCS 14, heart rate 120, BP 118/86.
You are in Old Black, you say yes, I'd agree that probably city is your closest.
Nice one, cheers Mucker. Yeah, we'll alert direct and appreciate it for that.
There is a real chance of Joe rearresting, so Mitch will travel with her to continue giving emergency care throughout the 4-mile journey.
So guys, what we're going to do is, if she has another arrest, we're going to do 3 stack shocks if needs be, okay? Happy with that?
Yeah,
okay.
Sorry, Joe. Joe, how are you feeling? In pain.
Liam, just nice and sweet, mate. What we're going to do is we're going to do a cannulation in a bit, but I'll tell you when it is and we'll just pull over slightly, okay? Okay, we're just going to put a little needle in your arm, okay, lovely.
The cannula will allow Mitch to administer painkillers directly into her bloodstream, as well as prepping her for immediate treatment at hospital.
Yeah, that's probably from the compressions on your chest. Gonna get you sorted, lovely. You're doing really well, okay.
Just 4 minutes later, they arrive at hospital.
Good skills, top marks.
Where Mitch delivers his still critically ill, but now stable patient to the waiting emergency doctors.
From when we got there, we were met by the crew, and they'd reported that they'd just got a ROSC on her, so that sort of really changes the game plan for us. The crew were like literally 2 minutes away, delivered the shock straight away. Her heart was in such a rhythm that it gives the potential to go back into cardiac arrest, and there is like a window of where the heart is like sort of agitated, and actually it's quite likely they may go into arrest again. But on the same note, it was like a really good outcome.
Ambulance services, the patient breathing.
Yeah.
Are they awake? Are they conscious?
Yeah.
What's happened, sorry?
We're on a roof. It's a dislocated.
It's a dislocated ankle?
With a possible break, yeah.
Is he able to talk to me, or?
Yeah, you are able to talk.
So what happened? Did someone just tackle you, or did you...
Someone said...
Does your foot look cold, pale or blue?
It's covered in a sock and a boot.
Would you say you're in severe pain?
Yeah.
If the man's ankle is fractured, the broken bones could cut off the blood supply to his foot. A time-critical injury that must be treated on scene. So critical care paramedic Pete Edwards is en route.
So we're going to a male in his 40s who apparently has a fractured dislocation of his ankle. There is a crew in attendance who are requesting us, so I suspect it's for advanced analgesia.
The critical care team is trained in the use of high-strength drugs and painkillers, normally only used by doctors so they can carry out procedures in the field.
The ambulance crews carry gas and air, or Entonox. They carry IV paracetamol and IV morphine. And then we carry ketamine, which is a much stronger pain relief that gives sort of sedation as well. This is it.
9 minutes after he was called, Pete arrives at the rugby ground.
Hello. Hello, all right.
The ambulance paramedic updates him on the man's condition.
So far, Entonox on the field, onto the stretcher, giving me a score about 5 or 6 at the moment, but that's because it's not moving.
Okay.
You can feel sensation all around it. It says it just feels like pressure.
Hello, sir. I can see the problem.
40-year-old Dave was playing a friendly match when a nasty tackle floored him. He was carried from the field by the paramedics and given gas and air for the pain.
Yeah. And we've got a little bit like what looks like some critical skin there, haven't we?
The fracture is so bad that the skin around the ankle bone is dying because of the lack of circulation. If it continues, he could cause lasting nerve damage and he could lose his foot.
Dave, you've obviously got a fractured or a dislocated ankle. Looks like there's a little bit of compromise to the skin because of the bone. What we don't want it to do is the skin over the joint to sort of die or become necrosed, really. What we could do with it really is to pull it to a better alignment.
90 degrees isn't good.
No, I've seen better. I've seen better. I'm going to just uncover you a little bit, all right, so we can get to you. We've got a couple of options, haven't we? We run with it like that on blue lights into the manor, or we could give him a little bit of ketamine and just pull it, you know, to get rid of that critical skin, because obviously that's time critical, isn't it, really?
Administered correctly, ketamine will allow Pete to perform this procedure, putting the broken bones back into position and restoring the vital blood supply to Dave's foot.
Big deep breaths, that's it, all right?
I've got an 11-year-old male in the back of here. He can't get out, he's mechanically trapped from the left leg down. We haven't been able to see anything below there.
In West Bromwich, Dr. Ben Taylor and critical care paramedic Aidan Brown are at the scene of a serious car accident.
We're going to have a quick assessment, Ben.
A child is trapped in the wreckage with potentially critical injuries. With the temperature near freezing, they need to get him out as quickly as possible.
My initial plan at the moment is once that's all released and clear, look at sort of how he's actually mechanically trapped. If worse comes to worse, it goes a bit downhill a bit quickly, what we'll do, we'll get the ramp down through the middle, rapid.
That's your plan B, smashing. No worries.
Right.
I'm just going to have a go round and have a quick look at that leg, all right?
The police, ambulance service and fire brigade are working together to free him.
Hey, bud. How you doing? My name's Aidan. Right, I'm just going to have a quick look at your leg, OK?
When the car smashed into the lamppost, the front passenger seat was forced backwards and is now pinning the boy's leg to the floor.
Mate, can you just cut that? You'll see his mouth.
Before they move him, Aidan investigates his trapped leg.
Yeah, mate, it might be broken, OK? So bear with me, OK? I'm going to have to move it. I know it's going to be a bit painful. Just bear with it, be strong, because as soon as we get you out, we're going to give you some strong painkillers.
Getting him out without making his existing injuries worse is going to be a delicate operation.
I think we've got enough room to manoeuvre your leg now. Right, all we're going to have to do, mate, I'm going to lift your leg. OK, we're going to have to get you to shuffle to the back there. OK, so if you want to start shuffling your bum across, I'm going to support your foot.
We'll look after you. It'll hurt a wee bit, but we'll get you
mate, I've got it. I've got it.
Well done. You're doing very well there.
Well done.
I can't move because it's
Clue.
Frightened and in pain, the boy isn't able to move.
Let's just relax it there a second. Just relax it there.
But Aidan can't wait any longer. This is time critical. The boy has now been trapped for over 42 minutes in the freezing cold and is in extreme danger of becoming hypothermic.
We'll just get the longboard, like...
Can we get your longboard out your truck, please?
Yeah.
Thank you.
Ben?
Yeah.
And a back splint.
And the back splint, stand by.
Come, Mohammed, mate. I'm going to have you out in the warm in just a second.
Aidan oversees the fire brigade as they prepare to get him out.
Yeah, don't worry, we'll help you with that. I want you to lie your head down there for me. I've got your foot. Lie your head down. Well done, mate.
Longboard in position, the crew can now manoeuvre the boy out of the wreckage.
You guys happy there?
Once the feet are clear, you can pendulum them in.
OK, and we want him off the longboard, so we'll need to basically hold it at the side and slide him across if we're happy.
Here we go, mate.
Ready, steady, slide. Well done. Second, OK, get you nice and warmed up, all right?
Finally out of the car, the crew lay the boy on top of the stretcher.
Any pain up here? No? OK, any pain down there?
Yeah. Aidan assesses him and confirms his left ankle and foot are badly damaged, with potential multiple fracture and dislocation.
We'll get him in the warm first and we'll do it from there if you're happy.
The blood and nerve supply could also be compromised.
Let's go in there. I bet you're cold now, aren't you? You've been brave lad, haven't you? Very brave. I'm just going to go into the ambulance now. You see your fam. All right? Good man.
With a temporary splint on the injured ankle and wrapped in a foil blanket to try and warm him up as quickly as possible, the boy can now be moved into the back of the ambulance.
Any pain in your chest? No?
Aidan carries out a thorough examination of his chest and vital organs to be sure he hasn't suffered any undetected internal injuries.
Ben, I'm happy that it's isolated.
Happy, like,
tib fib.
Ben, happy for us to clear, crew can transport it out, I thought.
The boy is now in a stable enough condition for Aidan and Dr. Ben to leave him in the sole care of the ambulance crew for the 8-mile journey to Birmingham Children's Hospital.
Took a little bit of time to get him extricated from the vehicle. He's got quite severe lower leg fractures, which will need treatment at a specialist trauma centre.
It's difficult when you go to a child that's the same age as one that you have at home, and it brings home a little bit closer and breaks through the veil a little bit. It's bad enough for an adult to be in that position where they're trapped inside a crashed car, probably very scared, probably getting cold, probably in a lot of pain, but as a child it must be significantly worse and significantly harder.
Yeah, it's
quite deep.
I think we have gone through some tendons or ligaments there, haven't we? But it looks like it.
In Birmingham, critical care paramedics Will Meadows and Colin Apps have been called to an accident on a building site.
How old are you, so mate?
26.
So it's a tool that sort of dropped onto his arm.
Yeah, plunge saw.
Like a table saw.
Rich was operating a mechanical saw which got caught in his clothing. The wound is so serious, he's in danger of losing some of the use of his arm.
Have you got a good sensation in all your fingers?
Yeah, I can feel them all.
Can you move them well?
Pins and needles.
Do you feel like your grip is weak?
I can fully grip that.
Last year, there were 54,000 injuries on building sites.
Do you feel sick at all?
Yeah, a little bit. A little.
This is a 26-year-old chap who is working on a construction site with what he calls a plunge saw.
Will phones control to update them on Rich's condition and discuss which hospital he should be sent to.
This saw has come down onto his the inside of his right forearm, and it sustained an isolated open laceration. It's quite deep. There's a lot of stiff adipose tissue, and it looks like there's possible tendon and ligament damage there as well. As he was sort of moving, you could see stuff moving in the forearm, if you know what I mean. We'll go with QE as his destination.
Rich's arm urgently needs to be assessed by a plastic surgeon, which means he will be blue lighted to the Queen Elizabeth Hospital Major Trauma Centre in Birmingham.
There's no sort of foreign bodies, debris or anything. It wasn't dirty, was it? It did look clean, didn't it? Yeah.
Rich's blood pressure and heart rate are returning to normal, so the ambulance crew can give him some pain relief with less risk of him passing out.
What we might do then is pop a little cannula in your arm, give you some paracetamol that way.
How much pain are you in?
Well, it's getting worse as it's going, because I'm calming down a bit.
Yeah. If you had to give the pain you're in a score, a mark out of 10, 10 being the worst pain,
I'd say maybe about a 6 or 7.
Oh.
22 minutes after they arrived on scene, Rich is ready to start the 5-mile journey to hospital.
You get that arm sorted, right?
Yes, guys, thank you for your help.
Well, there you go. Take care. Get well soon.
Satisfied with his progress, Will and Colin are happy to leave him in the care of the ambulance crew.
Is it okay to pop you on just a little bit of oxygen? Is that all right?
8 miles away in Walsall, following a bad tackle on the rugby pitch, critical care paramedic Pete Edwards is about to try and realign the broken bones in Dave's ankle.
Have you ever had ketamine before?
I've had morphine before.
Yeah?
It's been over 40 minutes since the accident. Deprived of blood and oxygen, healthy tissue can suffer irreparable damage, so Pete needs to act fast to restore blood supply to his foot.
He's got dislocated or fractured ankle or both, but what we've got is what we call critical skin over the joint, so that means that the skin is that tight, it's restricting the circulation to it, and it is quite important that we restore circulation. So just going to get a little bit of sedation, try and pull it straight and get into the hospital as quick as we can. Have you given it someone Danzatron or...?
Before Pete injects the ketamine, it's vital he gives Dave a dose of anti-sickness medication to help him tolerate it.
All right, to give him a bit of that, just... Is that all right? His observations are all right, aren't they? So that's ketamine, 10 milligrams per mil, so in here is 200 milligrams, all right. Have you seen it given before, Stu?
Ketamine?
Yeah, OK, all right, so it's just have to be no sudden noises. All right, I'm just going to go some very small amounts to start with, all right? It's Paul, isn't it? I might just feel a bit woozy, that's all right?
Or nervous?
Yeah, don't worry, all right, OK. We're going in very small increments here, just to gauge a response, all right? Giving a really small dosage.
The skilled and effective use of drugs like ketamine is a vital part of the critical care team's training. In the wrong setting, it can cause unpleasant psychoactive disturbances, so keeping a calm, controlled environment is very important.
I'll just give that a minute or so just to work in.
As the drugs start to take effect, Pete closely monitors Dave's reactions.
You hear me, Dave? You hear me?
Yeah, okay.
Yeah? Lift your arm.
Pardon?
Lift your arm.
Lift it.
Yeah. OK, all right.
It's a difficult judgment. Not enough, and Dave won't be able to tolerate the pain of manipulating his ankle.
Just give him a little bit more.
Too much, and it could suffer the adverse side effects.
All right, Dave.
With the ketamine now in Dave's system, he is hopefully oblivious to what's going to happen.
OK. I'm going to give it a little go at that, all right? You might shout.
Pete needs to proceed very carefully. There are 3 main bones in the ankle. They could all be broken. And they all need to be correctly aligned if he's going to reverse the damage done by the lack of circulation.
All right, Dave?
Oh, all right.
OK, that's a bit better. OK. That looks a bit better alignment. Skin colour's going back as it... Let's just check for a pedal pulse. So just check, yeah, the critical skin has gone. I've got a good pedal pulse. Cap refill on his foot, although it is cold. OK. Shall we just pop a vacuum splint on that then? And I think that's all good.
It's worked. With the bones now realigned, blood is circulating properly to the foot.
Dave, all done.
Yeah, it's looking better.
So he probably doesn't. He's answering us, but I don't think he knows.
Is that normal for the ketamine?
Yeah, that's a good indicator that it's kicked in. Yeah. Pop that oxygen mask back on him just for a sec. I mean, he's satisfying, but.
Pete encases the ankle in a splint to create a rigid support for the journey to hospital.
Now he's relaxed. Look, it's come back. There we go. OK, yeah. I'll put a bit of traction on, and you put that vacuum splint on. Yep. If we just keep our eye on it. Super. So I can see it. Skin's good. OK, that's lovely. So Walsall Manor, innit? I think we're quite happy now. We've got rid of that critical skin, so we could just have a nice steady ride in.
Pete will travel in the back of the ambulance with Dave to keep him under close observation while he is still under the effects of the ketamine.
Are you warm enough?
I think so, yeah.
Yeah? Do you know where you are now? No? It's good stuff, isn't it, that?
Kind of feel floating is the easiest way to describe the way it feels.
It can take several hours for ketamine to wear off, but Dave shouldn't have any memory of his ankle realignment.
Do you feel like you need anything else for pain, or is it OK?
No, it's OK. It's nice to be able to see that my toe is now actually
pointing the right way.
Yeah, up my other than pointing.
Yeah, it didn't look very good, did it?
No.
We're here now, Dave. You'll be glad to know, all right? Bit of fresh air might just make you feel a bit better as well.
Maybe light-headed.
He had a little bit of a moment where he was as high as a kite, for want of a better description. He seemed a bit bewildered, you know, what's just happened and where am I? But after a bit, slowly, he was back to as he was as normally, so it was a good result.
We joined together, didn't we?
On this team, yeah, we did. It's just short of 2 years, isn't it?
Yeah.
In the critical care car, paramedics Sarah Foley and Becky Chappell are on their day shift.
It's nice to have the option to do something slightly more, isn't it?
Yeah, definitely.
I think once you've had a few years as a paramedic dealing with general treble 9 calls, it's nice to specialise your skills and increase your knowledge in one specific area and be able to target it. Variety is the spice of life.
Ambulance service, just the patient breathing. Just had an accident. Can't through this foot. Okay. Are they breathing at the moment? He's breathing at the moment when he's in the middle of the road. So what's happened? My driver just pulled out and he's just been flying. And he's ripped the whole skin over his foot. Was he on a motorbike or a push bike? Motorbike. Is he bleeding very heavily? Yeah. Puddle of blood around. Got a clot around it. Ankle's literally gone. It's cut open. And, you know, showing to move. Is there any complete or partial amputation? I'm not quite sure, sir. I can't see it. Is the ambulance on the way, yeah? Yeah.
White Delta 98.
No, you're not too far from this thing, about 4 minutes. It's RCC, motorcycle big car.
That's lovely, thanks Steve. We'll go and have a look.
When a car hits a motorbike, injuries can be complex and life-changing. An ambulance has been dispatched, and Becky and Sarah's enhanced clinical skills are also needed.
All we know at the moment is that there's a leg injury. Somebody's come off a motorcycle, only 2 minutes away.
At the scene, they are briefed by the ambulance crew.
Hi there, you all right?
He was on his bike,
Yeah.
and a car turned right in front of him, and he's got to come off the bike, and I think he might have fractured his ankle.
No KOs? No.
20-year-old Jake, a restaurant assistant, was riding home from the motorbike test centre when he crashed into a car. The impact dislodged his boot, throwing him off his bike onto the road in a hard landing that caused several gashes to his foot and injured his ankle.
You felt down all his back and neck and he's got no pain? Yeah, no, as long as you're happy. Can I just have a quick look at it? Would that be all right? You've got no pain anywhere else? No. Okay. Were you thrown at all?
Yes.
Yeah? You got no pain higher up in your legs? It is just
that's my
here.
most concern.
Yeah. All right. We'll be able to wash that once you're on the ambulance. Yeah,
motorbike versus car, no loss of consciousness, appears to be an isolated ankle fracture. No further resources required. Going to grab him on the back of the ambulance and fully assess him.
You're right.
Ruling out further serious injury, Sarah needs to get Jake onto the ambulance to carefully assess the damage to his ankle and lacerated foot.
I'm going to just let go of that for a moment. All right.
Out at 10, mate. How bad is this hurting you?
Oh, fucking 11.
10 is the worst pain you've ever had in your life. 10's me cutting your arm off.
Mate, this is...
It's right up there, yeah?
This is the worst thing I've ever done.
Can I cut these before the cannula goes in? Is that all right? It just makes life much easier.
I'm terrible with needles.
Right.
We need to get some pain relief into you, don't we?
There we go.
That's the only way we're going to manage there at the minute.
Okie dokie. Right.
Before Sarah and Becky treat his injuries, Jake needs a cannula inserted into the back of his hand for intravenous pain relief.
Oh, mate, give me a second, please.
But Jake has a fear of needles.
I'm shit with needles, like absolutely terrifying.
Just talk to me about what happened.
I've just come back from Sutton Coldfield because my theory test is tomorrow for my motorbike.
Oh. Okay. How fast were you going?
I was going about 30.
About 30. Okay. Just look down towards me. So you're going about 30. Were you wearing a helmet? Yeah. And your jacket, is that the only jacket you had on, or?
That jacket, I'm on motorbike jacket.
Yeah.
He's just come straight in front of me and I've gone in.
You've gone into the side of him then? Because he's gone in front of you?
I think, yeah, morphine and paracetamol. You're okay with paracetamol? You haven't had any in the last 4 hours? Okay, this is just normal paracetamol, but we give it IV and it's actually far more effective giving it IV as a painkiller. Okay, so that's 2021 paracetamol running through. Okay.
The intravenous drugs have been administered, but are going to take a short while to kick in.
My lovely, I'm going to just lift this up from here, okay?
In West Bromwich, critical care paramedics Becky Chappell and Sarah Foley are at the scene of a motorcycle RTC.
Just trying to work out what he's grazed and took the skin layers off.
As well as an ankle injury, 20-year-old Jake has a badly lacerated foot. The critical care paramedics are concerned the cuts are so deep they may have exposed bone that could become infected.
Okay, just that one really.
A bone infection can be difficult to treat and in extreme cases life-threatening.
That's the one, that's a little bit deeper down here. That...
Just trying to work out what he's grazed and took the skin layers off and what could potentially be bone.
Got good circulation, so he's got good pulses, the capillaries. Yeah, let's just put a bit more on. Hurting. Yeah.
12th of July, 19.
Are you all right to hold that back? Yeah.
Both IV paracetamol and...
Oh, I'll leave that up to you, please.
Yeah,
Satisfied that his wounds haven't revealed the bone, Sarah decides Jake needs an X-ray to check for any breaks.
I think, because we've covered the wounds, he's got such a large haematoma here. Well, we can try it and we'll leave it open over the haematoma then. Okay. And if it eases the pain, great.
A haematoma is a pooling of blood that has leaked from a damaged blood vessel into the surrounding tissue. To ensure the injury is stabilised and the bone supported, Sarah puts the ankle into a vacuum splint for the journey to hospital.
You ever had one of these before? I've never broken a bone in my knee or anything like this. We're going to do this, we're going to suck the air out of it, so it's going to go real hard around your ankles and it can't move, okay?
Confident Jake's injuries are not life-threatening, Becky and Sarah are happy to leave him in the care of the ambulance crew.
Jake, all the best. OK, we'll leave you with these guys. Obviously, just tell them if you need anything further for the paying. All right.
Thank you.
OK. No, thank you. Yeah, and you guys. He's very lucky, really. He's come off a motorcycle and at the moment it looks like he's got an injury to his foot. So it could have been far worse.